I'm Dr. J.D. Young. This is ACES Health and Medicine. If you're watching this as a parent, especially as a mother, there is a good chance you're here because you're worried about your adult child. You may feel like you have done many of the right things. You have supported them, you have encouraged them, you have probably sought professional help. And yet, something still doesn't make sense. Your child might be intelligent, capable, even motivated, but everyday adult life seems to overwhelm them in a way that's hard to explain. I want to start by saying this very clearly. This is often not a failure of parenting, motivation, or character. Most parents I work with are holding two worries at the same time. One is, if I don't help my child, things might get worse. And the other is, if I keep helping, am I preventing them from becoming independent? That tension is exhausting, and it becomes even heavier when no one has been able to clearly explain what's actually limiting your child. What I see over and over again is that many struggling young adults aren't lacking intelligence or effort. What they're lacking is capacity, especially brain and the nerve system capacity. Capacity is about how well the brain and the nerve system handle stress, regulates emotions, sustain energy, and recover. That capacity can be reduced by many things: chronic stress, trauma, concussions, inflammatory process, and a long period of overload. When capacity is reduced, even simple adult responsibilities can feel overwhelming. From the outside, it can look like avoidance or failure. From the inside, it feels like exhaustion and shutdown. Most parents respond in very reasonable ways. Some try to push a little harder, hoping it will help their child break through. Others pull back and try to protect their child from stress. The problem is, pressure doesn't increase capacity, and removing all demands doesn't restore it either. Many conventional approaches focus on symptoms or labels without addressing underlying systems that actually regulate function. That's why so many families feel like they have tried everything, but nothing quite works. At the Young Institute, we work with a small number of young adults and their families using a structured brain and behavioral-based framework called ACES model. I want to be clear about this. This work is long-term, individualized, private, and non-insurance. Because of that, it is not the right approach for everyone. A big part of what we do is figuring out whether a young adult and the family supporting them are actually ready for this kind of work. Our goal is not fix someone for their parents. Our goal is to help restore enough capacity so independence becomes possible again. For many parents, especially mothers, this perspective brings a sense of relief. It helps explain why things haven't worked without assigning blame. Supporting your child within the right structure doesn't create dependence. In many cases, it's what allows independence to develop again. I do want to be honest about boundaries. This work isn't designed for crisis situations, quick fixes, or short-term solutions. It requires time, consistency, and a willingness to invest in a structured process. If that doesn't fit your family's situation, this probably isn't the right approach, and realizing that early can save a lot of pain. If what I'm describing resonates, the next step isn't a commitment. We have created a brief nerve system capacity assessment for families who want more clarity. It doesn't diagnose, it simply helps you determine whether this kind of intensive, brain-based work might make sense to explore further. You will find assessment linked below. Thank you for watching.